I'm not saying that everyone should not have this. Not at all. A lot of people, it is very beneficial, especially people who are, can't maybe be on certain medications or can't do the root cause because of cost, right? Things like getting toxicity testing and removing these toxins from our body to fix our metabolism is not a financial option for everyone, okay? But the point of this episode is just to kind of make you aware of some of these things, explain other options you have, to at least explore fully with an endocrinologist or health coach to really see if there is another option before you change your entire anatomy that you can't undo. Hello friends, happy holidays. I'm loving all the festivities and all the good things. But for a lot of people, the holidays are not a fun time. I notice a lot of my patients very, coming in saying, oh, the holidays, and talking about their weight, their diabetes. And a lot of people are considering, permanent solutions for after the new year, such as bariatric surgery. And, I have a lot of patients who've gone through this. I have a family member, my mother, I always call her Gam, or Michelle when it's just me and her, just because she's such a force and, she gets nicknames. What can I say? And so I felt very passionate today to kind of talk about bariatric surgery because it's not a light thing, and I think because so many people do it, it's almost considered like a lighter surgery, and people aren't scared of the side effects because they're not discussed. And I'm not saying bariatric surgery is bad. It's helped obviously so many people, but for the wrong person, bariatric surgery could be the worst mistake you've ever made in your life. And my mom would be the first one to tell you she regrets having her bariatric surgery. And it's one of the main reasons I went into endocrinology is because I personally was nervous when I was putting on a lot of weight and became diabetic that's the route I would have to go to help myself. And, I'm so grateful because I was able to learn from my mother's experience and understand that I have the same genes and I could suffer from the same things she did as a result of bariatric surgery. Now, that's her story, so I'm not going to go too deep into it. But what I will say is it absolutely affected her and caused her a lot of problems down the line. And I'm purposely not going to say everything about her case only because I don't want to tell people you can't get bariatric surgery, but I do want to let you know about all the things that can happen. And if you find you have this kind of family history or something that makes you think you may have one of these problems already, maybe it's not the best option for you, and maybe there's other things you haven't even tried yet that could be an option besides changing your anatomy. Welcome to the Vitality Prescription. I'm Dr. Yaz, your host and triple board certified endocrinologist and obesity specialist, and today we're diving into a critical and often sensitive topic, bariatric surgery and its role in managing diabetes and weight struggles. See, while bariatric surgery can be a life-changing option for many, it's not the answer for everyone. And in this episode, we'll discuss 4 signs that may indicate that surgery is not the best option for you. We'll also explore medication options, the principles of intuitive eating, and the issues related to addiction that can arise post-surgery. So, in my practice, I've had multiple people go through bariatric surgery, but honestly, I've been in practice. Wow, I'm getting old. I graduated med school in 2016, okay? So basically, it's been a minute. And I've had maybe a handful of people go for bariatric surgery. And these are people where everything else was exhausted. Generally, unless someone comes in and is like, I've already signed up for the surgery, I definitely do encourage my patients to try other avenues first before jumping into surgery because the side effects or problems with it can be really drastic and people don't talk about it. A surgeon may not talk about it. I know for my mother who had it, they did not tell her half of the things because I was with her for those appointments. And it was before I became an endocrinologist that this had happened. I was a kid when it happened. My mom, she was teased mercilessly growing up. She was called names. She felt embarrassed. She was in pain from her knees. She was truly suffering. The weight loss options that are on the market now, including looking at your metabolism, looking at toxicities and removing, root cause issues in metabolism, were not available yet. She did what she thought was best for her at the time, and at the time I thought it was the greatest thing for her. She lost weight, she felt great, her knees improved, she became really fit. But she had other issues happen to her health later down the line. And I think the point of this episode is just to kind of make you aware of some of these things, explain other options you have, to at least explore fully with an endocrinologist or health coach to really see if there is another option before you change your entire anatomy that you can't undo. Basically, bariatric surgery includes various procedures designed to help individuals lose weight, altering the digestive tract. The most common types of bariatric surgery are gastric bypass, and this is the one recommended for most diabetics. So this surgery involves creating a small pouch from the stomach and connecting it to the small intestine, bypassing a significant portion of the digestive tract. And this leads to substantial weight loss and can significantly improve diabetes control. Actually, even in an article of the New York Times, they talk about diabetes reversal and explaining things like, when we see people do surgery, well, it's reversed, right? And the reality is, most of that, yes, maybe part of it has to do with, where they're bypassing. But also a decent part of it is just that it's limited the food. Another option is sleeve gastrectomy. In this procedure, 80% of the stomach is removed, leaving a tube-like structure. It not only limits food intake, but also affects gut hormones that impact metabolism and hunger. Another one is the adjustable gastric banding. This involves placing an inflatable band around the upper part of the stomach to create a small pouch. And while less invasive, it may lead to less significant weight loss compared to other surgeries and requires ongoing adjustments. Another option is the biliopancreatic diversion with duodenal switch, or BPD/DS. And this is much more complex, and this involves removing a portion of the stomach and bypassing most of the small intestine. And it results in significant weight loss, but carries a high risk of complications. So before I, go on about the negatives of bariatric surgery, because I'm not saying it's not, that everyone should not have this. Not at all. A lot of people, it is very beneficial, especially people who are, can't maybe be on certain medications or can't do the root cause because of cost, right? Things like getting toxicity testing or removing these toxins from our body to fix our metabolism is not a financial option for everyone, okay? But, it is to say nothing comes without side effect. Now, let's talk about the benefits first. First, significant weight loss. Many patients experience substantial weight loss, which can lead to improvements in comorbid conditions like type 2 diabetes, hypertension, sleep apnea. It improves blood sugar control. Studies show that many patients see improvements in their glycemic control and can even achieve remission in diabetes post-surgery. A notable study published in Diabetes Care found 60% of patients achieve remission within a year of gastric bypass surgery. And how long that lasts changes depending on which study you're looking at. There's 1,000 studies on this. So I'm not going to quote a bunch of studies, if we'd be like, oh, she said, this percent or this percent, but it's out there. A lot of people do improve their diabetes tremendously, and this is a huge weight lifted off a lot of people's shoulders. Now, I want to talk about the risks and considerations. See, first of all, there's surgical complications. As with any surgery, the best surgeon can even make a mistake. There are risks for complications, including infection, blood clots, and nutritional deficiencies. For instance, 30% of patients can experience complications within the first year of surgery. And I have patients all the time having these problems, where the pain doesn't go away, or they become deficient in nutrients that help with their memory. They feel like they can't stop vomiting all the time, or they feel they lost weight too quickly and they get depressed. There's a lot of different things that I've seen happen, and some of this published and some is just from clinical experience. A lot of people who come to me regain weight after the bariatric surgery as well. So I've seen people on early, late, 15 years down the line, 1 year down the line, everything, I've seen it. And the one thing is there's also, lifestyle changes. You can't go back to eating the way you used to. So post-surgery, you have to adhere to strict dietary guidelines and ongoing medical follow-up. And so if you don't see someone for medical follow-up, you can have definitely even more complications and definitely weight regain. I'll say this, people who've regained weight on bariatric surgery, I have noticed a trend that a lot of them do not follow with their doctors yearly because they feel like everything's fine, they don't have to. But maybe something like that yearly checkup does help. The next thing I want to do is talk about signs you may not be ready for this, okay? So the first sign is lack of readiness for lifestyle changes. So, is your mindset geared up for lifestyle changes that come after bariatric surgery? Let's find out. One of the most critical factors in the success of bariatric surgery is the patient's readiness to embrace a new lifestyle. The surgery is just a tool, but without commitment, regular physical activity, and psychological support, long-term success will be challenging. If you're unwilling to change your eating habits, right, or you're not ready to adopt a healthier lifestyle, surgery may not be effective. For instance, a lot of people will revert to old eating habits and they can regain the weight after the first year. There's a bunch of studies, and one found that 50% of patients who underwent bariatric surgery regained a significant amount of weight due to failure to adhering to dietary changes. The next thing is you may not have the support system that you need for this. See, a strong support network is vital for long-term success. If you do not have family or friends to support your journey, this could be a red flag because research shows that individuals with a solid support system are more likely to succeed post-surgery. And there's evidence shown that individuals successfully losing weight and maintaining it after surgery often have a robust support system, and they have a commitment to necessary lifestyle changes. Basically, they found that post-engagement and post-operative support groups also improved outcomes. And I talk about this all the time in my diabesity program. In our membership, basically, our clients, right, can support each other. And they're not in bariatric surgery, but some are pre or post, but most of the people in our membership are just trying to do lifestyle choices and getting at the root cause and removing, toxicities and different things that are affecting their metabolism, right? And they want to eat a certain way to stop these things that are hindering their metabolism and want a true lifestyle change. But either way, the premise is the same. When you have people supporting you, keeping you on track, giving you ideas, you're in a community. And when you're in a community, you tend to behave like your community. And you could say the same thing for kids in school, right? You go to a certain school and the kids are a certain way, your kid likely will act a certain way. If your kids are in a different school, they may act differently. So the same thing goes for when you're trying to lose weight or fix your blood sugar. If you're around people who are trying to lose weight and fix their blood sugar with lifestyle and natural changes, you're likely going to do the same. The next sign, number 2, is unmanaged mental health issues. So, are you addressing underlying mental health challenges? Let's explore why this is crucial, because mental health plays a vital role in management and may even be the cause of why the weight is an issue to begin with. So if you don't fix that before bariatric surgery, conditions like depression, anxiety, eating disorders, it can absolutely hinder your ability to comply with post-surgical guidelines. So signs of unmanaged mental health issues. a history of eating disorders. So if you've struggled with binge eating, bulimia, or other eating disorders, it's essential to address these causes before considering surgery. See, studies show that 30% of individuals who undergo bariatric surgery have a history of eating disorders, which can complicate recovery. The other issue is ongoing mental health struggles that can interfere with your motivation or ability to make the necessary lifestyle changes post-surgery, like depression or anxiety. See, research indicates that untreated depression can lead to a higher likelihood of complications and poorer surgical outcomes. And studies have shown that individuals with untreated mental health conditions are at higher risk for complications after bariatric surgery, including weight regain and poor overall outcomes, and it's crucial to seek psychological evaluation and support before making surgical decisions. A meta-analysis in psychosomatic medicine found that psychological support significantly improved post-surgery outcomes for individuals with pre-existing mental health issues. Now, I'll tell you this, I have a lot of patients who go through bariatric surgery, and do I see them following with a mental health professional afterward? No. And especially for people who come to me with weight regain after the bariatric surgery years before, they were never told to follow up with a psychiatrist. They had them for their evaluation to say they were medically cleared for surgery, but they were never told to follow up with them afterward. And moreover, if you or anyone you know experiences mental health or problems with their mental health, like anxiety, depression, eating disorders, you tell me, if you meet someone for the first time, like a psychiatrist for a 15-minute evaluation for medical clearance for a surgery, do you think that psychiatrist is going to know everything in 15 minutes of getting to know you? Probably not. So if your first time seeing a psychiatrist for this was for evaluation for the surgery, I would highly recommend not to get the surgery right away. I would let them meet with you a few times. I'd really get to know them. Let them get to know you. Understand where the overeating is coming from. Understand that maybe you need help with the behavior changes that have to do with emotional eating or mindless eating or intuitive eating. And maybe the eating disorder or problems with our society has caused you to think about food in an unhealthy way. You know, there's a lot of things to this. And I will say, I used to have a very unhealthy relationship with food. And now that it's much healthier, I'm so grateful I didn't go for surgery because I would never have actually fixed the root cause of my problems, which included a mixture of a lot of the root causes for diabetes and obesity. So next on the list, lack of commitment long-term. Are you prepared for lifelong commitment that comes with bariatric surgery? Let's find out. See, bariatric surgery requires a lifelong commitment to regular medical follow-ups, nutritional adjustments, and lifestyle changes. And if you're not ready for this, surgery is not the answer for you. See, one thing that shows a lack of commitment, I want you to look back at the last 5 years of your life. Have you been consistent at your medical appointments? If you struggle with regular checkups or follow-up visits, this could indicate a lack of commitment to post-surgical process. So research shows that patients who attend follow-up appointments are more likely to maintain their weight loss. A lot of people develop disinterest in nutritional education. See, a successful outcome involves understanding nutritional needs post-surgery. And if you're not willing to learn about dietary management, you may face those challenges after the procedure. A study in bariatric surgical practice and patient care found that patients who actively engage in follow-up care are more likely to achieve and maintain their weight loss goals. So commitment to this journey is essential for your success. The next sign I want to talk about is alternative treatment options available. Are there effective options to bariatric surgery that you have not explored yet? Let's discuss them. Before resorting to surgery, it's essential to consider all available options. 1. Medications, right? Like your GLP-1 agonist or stimulants like phentermine are an option that can help with weight loss, especially while you work on those emotional causes that cause overeating, or lifestyle things that are inhibiting you from doing things like exercise. When it comes to diet and exercise, yes, a lot of people, diet and exercise, still need bariatric surgery. I'm not saying that doesn't exist, but a lot of us have not actually found out why we can't do those things. And if we can't figure out why, just put a solution on that like that, really, I don't think is the best idea. And I'll go even further. I've been treating patients with GLP agonists forever in our office. And not only that, but I grew up with them in my house because my dad, who's diabetic, had used them since I was a kid. He was on the original Byetta all the way to Mounjaro now. And I'll tell you this, these medications, like the GLPs, increase insulin secretion, suppress appetite, and improve satiety, leading to weight loss, okay? And basically, these medications can help you achieve very similar results to things like the sleeve. My dad lost a ton of weight with these medications and never needed surgery for his diabetes. And I will say, even if he hadn't found that medication, with lifestyle changes, he probably could have done it too. Now, I'm not saying that's everyone, but I'm saying for a lot of people, that could be an option instead of surgery. And I would definitely say with the newer medications on the market, don't say you failed the medications until you see a specialist. Okay, I want you seeing an endocrinologist or obesity specialist who's been working with these drugs for years. And even better yet, has known about them before, because there's a lot of new people doing them online who are, just not well versed. They haven't been dealing with these medications the way other people are trained and have been dealing with them. So example, there's many trials on this, but medications like semaglutide led to an increased weight loss of around 15% over 6 to 8 weeks, which significantly improves metabolic health. The other thing I want to discuss is just intuitive eating. Most people will say, eat this many calories, eat this type of food, cut out this, cut out this, cut out this. How many people in the doctor's office teach you how to intuitively eat? It's a philosophy that encourages individuals to actually listen to their body's hunger and satiety cues instead of following restrictive diets. This approach can be beneficial for those considering bariatric surgery since it would help you with bariatric surgery anyway, right? Because after bariatric surgery, your hunger and satiety cues are going to completely change. And if you still eat the same as you did before, with that, you're going to feel sick. And then over time, the bariatric surgery will not work as well, and then you'll go back to eating the way you were. But if you actually took care of learning to eat when you're hungry, stopping when satisfied, and focusing on more nutrient-dense foods, you would develop a much healthier relationship with food. Now, the challenge is this. There's a mindset shift that has to happen. When you transition from dieting mentality to an eating in an intuitive way, it can be challenging, okay? Particularly for those with a history of restrictive eating or dieting. So, a study in nutritional psychology found that intuitive eating can improve psychological well-being and reduced disordered eating patterns. So many individuals need guidance on how to stay in tune with their body signal and distinguish between physical, hunger, and emotional eating. The research indicates that intuitive eating can lead to improved body image, reduced eating disorders, and healthier weight outcomes. Now, the next segment I want to talk about is addressing the potential addiction issues post-surgery. Did you know that bariatric surgery can lead to new forms of addiction? Let's explore the issue now. One significant concern for bariatric surgery is the potential for addiction transfer. Means individuals develop new addictive behaviors, such as substance abuse, compulsive eating, as a way to cope with emotional challenges post-surgery. So let me talk about some signs for addiction issues. One is compulsive behaviors, engaging in compulsive eating, or substance use as a coping mechanism for emotional distress, or ignoring consequences by continuing harmful behaviors despite negative impacts on the health or on their relationships. See, in a study of obesity surgery highlighted 30% of patients may experience addiction transfer after surgery, developing issues with alcohol or other substances due to emotional shifts and lifestyle changes following the procedure. This makes it crucial to have comprehensive psychological support before and after surgery to address these concerns. So if you have a family history of addiction, maybe consider not doing the surgery until you've addressed your chance for this. It's a real thing. Imagine if you're eating for emotional support, right? And someone took away the food, took away your ability to eat as much as you wanted to numb your feelings. So what do you think you're gonna do? You go to a party, you have a glass of wine, you say, oh, that made me feel better. Then maybe at home you start drinking wine, and then you drink a glass, 2 glasses, 3 glasses, or whatever it is. When I say that, it's not to call it out and say that's gonna happen in bariatric surgery, but it happens all the time, and I see it so many times. When I say so many times, I'll ask someone, what did they eat all day? And they'll tell me the healthiest menu. And then I'll say, wait, are we drinking anything? Is there anything we're drinking? And sure enough, it'll come out of the woodwork, okay? And unfortunately, when you've rearranged your anatomy and that's the only way someone can buffer, it's very difficult for them to help with their addiction. So I discussed today 4 signs that may indicate bariatric surgery is not the right choice for you in managing diabetes and weight struggles. The first, lack of readiness for lifestyle changes. Commitment to new habits is essential for long-term success. 2, unmanaged mental health issues. Addressing mental health is crucial before undergoing surgery. 3, lack of long-term commitment. Surgery requires ongoing dedication to follow-up care and lifestyle adjustments. 4, alternative treatment options are available, like non-surgical solutions, which can provide results without the associated risk for surgery. So what I want to say is, what I've learned in my medical practice, and what I've seen time and time again, if a person on a medication could not achieve some weight loss, meaning your GLPs, which are kind of almost like, a temporary gastric sleeve for a week, right? And they're doing all the right things and they still can't take care of those issues, they should not jump to bariatric surgery. They should fix those issues first. I've noticed if someone could not do it with medication, I seldom see long-term it working with the bariatric surgery because both are essentially doing the same thing. They're decreasing the hunger cues. The only difference is you can stop taking the medication after a week and the surgery is permanent, so you're going to have to deal with it and either fix it or you're going to have a problem. But I would say that's one really good telltale way to know if something's wrong. The next thing is, before deciding on bariatric surgery, take the time to really assess your readiness, explore all the available options. And while some patients may benefit significantly from surgery, others may find success through medication, intuitive eating, and behavioral strategies that do not involve the risk associated with the surgeries. I want to thank my mom for letting me share her story here. I didn't get into too much detail. I would love to have her on to discuss it more because she's the one who's gone through it. But I will say, taking surgery lightly because everyone's doing it is not a good move. I think you need to think about yourself and assess yourself personally and do every other route before you jump to that, solution. Anyways, thanks for joining me on the Vitality Prescription. If you found this episode helpful, please subscribe, leave a review, and share it with others who might benefit. And for more information and links to other sources, check out the episode notes. And until next time, take charge of your health and remember that managing diabetes and weight struggles is achievable with the right strategies.